Now it's about 5,000 cases a day. It is reasonably, it's quite high, but it's not low either. So it is possible that it will go up some more. But I think it's not something that we have not seen before. I think a bit of anxiousness is not a bad thing. It shows that we actually are still quite attuned to the pandemic, and that when there's a new wave, a bit of anxiousness means we will also take precaution. Just don't be overly nervous, overly excited by it. So I don't see it as a bad thing. My own sense is that today, based on the healthcare impact, we have less than 10 ICU cases. We have gone through 3 over years of pandemic with all kinds of SMMs and safe management measures. And finally, earlier this year, got our DORSCON green. Going back is the last thing on our mind. Yeah, going back will be the last thing on our mind, and also the last thing on Singaporeans' mind. But given the kind of healthcare burden that we are shouldering, I think we can withstand this quite smoothly. A few things that we can all do. Number 1, observe good hygiene habits. Wash your hands often. Don't rub your eyes, don't dig your nose, and because that will introduce virus into your body. Number 2, very importantly, if you're sick, don't get into contact with other people, especially seniors. Yeah? And after you recover, wear a mask when you go out. Yeah. Of course, there are people who say, I don't have ART kits to test. But actually, we are not just worried about COVID now. There's also all other viruses that's going around, like adenovirus, RSV, influenza, mycoplasma pneumonia. They're all going around. Thirdly is, if you are well, but you're in a crowded area, or you go to the airport, and airport tend to have a lot of people with sickness, then wear a mask and protect yourself, especially if you will come into contact with seniors and vulnerable people. And lastly, what I nag most, sometimes to no avail, is that we have to continue to take our vaccines, especially if you are a senior, 60 and above, or you have chronic illness. Take the vaccine once a year. Today, I feel reasonably optimistic because 60% of our population are recently vaccinated, have minimum protection, and recently vaccinated. Recently means within the last 12 months. Yeah, so we have good immunity. So even if we are infected, not likely we'll fall very sick. But if we do not continue to vaccinate and we wait till next year, I think instead of 60%, we may only have 20% that's recently vaccinated. And when another wave hits at that point in time, the impact will be greater.